My name is Brittany Lutz, and I did my research project on preventative dental treatments and broken appointments. Just a little personal background information about myself. I graduated from Youngstown State's Dental Hygiene Program in May of 2008, and I'm currently employed at Lisbon Community Dental Center, where I started September 1st, 2008, and I am currently working there. As all organizations normally do, they have a mission statement. Our agency mission statement, which would be Community Action Agency, is to assist county residents who are low income, elderly, or disabled to achieve self-sufficiency and enjoy a better quality of life. The Dental Center's mission statement is to provide quality, comprehensive, and affordable dental care to people of our service area. A little introduction to my research project. Oral hygiene care is an essential part of everyone's health, and patients may not always be aware of the importance of keeping their preventative appointments. This brings us to one of our biggest problems. High no-show rates cause low productivity, and essentially it has and could continue to cause budget cuts or the loss of grants, and sometimes even the loss of jobs. So I feel like evidence-based research may give us a little insight to this difficult problem and ways we could solve it. Some of the things that may be included in preventative dentistry are dental checkups every 6 months, dental cleanings every 6 months, sealants on occlusal surfaces as soon as eruption, and fluoride treatments. Preventative dental care in the patient. The two most important jobs as a hygienist is health promotion and disease prevention. We do this by communicating effectively with our patients. We make them aware that there is an influence of the oral health on their total body care. For instance, anyone that has xerostoma, also known as dry mouth, it could be caused by cancer treatments or any other medications such as anti-anxiety or diuretics. This could increase their chance of cavities. Also, periodontal treatment. It improves the metabolic control of diabetes. Therefore, if you have untreated periodontal disease, it could actually affect the diabetes and make it worse on the patient. Also, undiagnosed dental infections could spread throughout the whole body, causing more harm than good to the patient. As stated before, it is important for a dental hygienist to communicate effectively with the patient. We do this by creating a preventative care plan. We educate the patient on the care plan. Some of the education may include proper diet, tobacco use, proper dental procedures, including toothbrushes, toothbrushing, floss, interdental products, and mouth rinse. We also motivate the patient. We give them goals and offer them any advice. As a dental hygienist, we set up a prevention care plan. First, we assess the patient's needs. We do this by getting a proper and full health history, dental history. We take x-rays. We ask questions. Next, we plan an intervention. We apply the information we gathered from assessing the needs, and we note any factors that may interfere with the care plan. We also will create goals. Next, we will implement these. We will use demonstrations such as proper toothbrushing, flossing, any interdental products. We'll also do tobacco cessation when indicated. Next, we will perform clinical preventative treatments. This is the actual dental cleaning, the application of sealants, as well as fluoride. Then we will evaluate the patient's progress. At each appointment, we will actually evaluate the progress the patient has made towards their goals. And lastly, we will plan the maintenance appointments. The average patient is normally put on a 6-month recall, whereas periodontal patients normally require shorter recall periods, and that's normally 3 to 4 months. Each patient's plan also varies based upon their needs. Special needs patients sometimes require shorter appointment recall periods. They also require more attention and education towards the guardian or parent. Periodontal patients, as stated before, are put on 3 to 4 month recalls. Children, normally they get the sealants and the fluoride, and other appointments could be need-based appointments. I did some research at my office, and this would be the hygiene no-show rate of the past years of my employment. So as you can see, I started from March 2009 to February 2010, and the no-show rate there was 48.98%. This is nearly half of my patients. From March 2010 to February 2011, it decreased by almost half to 24.35%. And this difference you'll see from the first year I did it, we actually put a no-show policy in place, and we'll discuss that later. And the last date I did was March 2011 to February 2012. And you can see the no-show rate also decreased almost by half with 13.51%. And from the year before to this year, we started using the Televox confirmation system. Some of the techniques we previously used to improve our efficiency and our productivity are Televox, and this is an automated call system. It calls the patients 2 days in advance, and they have options that they can push, such as to cancel the appointment, confirm the appointment, or Televox will also let us know if there's no answer or a disconnected number. Another technique we use is 2-day confirmation calls. We actually use this in coordination with the Televox. This is where we personally call the patients just to remind them of their appointments. We also perform 1-day confirmation calls, and this is for any non-confirmed appointments, and this is also used in coordination with Televox in our 2-day confirmation calls. And lastly, we also implemented the no-show policy. This was enforced in March in 2011, and it is just a contract between the patient and the office stating that they have 2 chances basically where they don't call and give us 24-hour notices before we discharge them from the practice. More detail about Televox. Like I said, Televox is an automated system. It actually saves the staff a lot of time. It prints sheets that allows us to access the calls that were received, messages that were left on our answering machine, no answers, hang-ups, disconnected numbers, etc. Therefore, when we do our 2-day confirmation calls, the ones that were already confirmed via Televox, we don't have to call them. Like I said, it calls 2 days in advance. The calls are made in the evening hours to the patient, so it doesn't, it has more chance, I guess, of reaching the patients if they are at work or school or etc. There was also a case that was actually done at University of Rochester where it showed that there was a significantly reduced broken appointment rate of nearly 27% with the use of this system. And like I stated, this is currently what we use at Lisbon Community Dental Center. This is our dental center no-show policy. As stated before, this is a contract between the patients and the dental center. So you can kind of read over this. It just kind of tells about scheduled appointments, canceling appointments, how we require 24-hour notice, and what a missed appointment is. Because of the critical lack of access in our area, these missed appointments are taken very seriously. Because if somebody misses their appointment, there was always somebody that's on a waiting list for months out that would have been gladly happy to take this appointment. We also have them sign that they understand this, that if they miss 2 appointments while giving us 24-hour notice, then they could quite possibly be discharged from our practice. When using age as a variable, you can see that the no-show rate for the age group 19 through 35 actually had the highest rate of the broken appointments at the dental center. It was stated in an article that I researched that the age group more likely to have families and careers was usually this age group of 19 to 35. And they kind of stated that after work they felt tired and overwhelmed, and dental care which is just lowest on their list of priorities. Phone calls to cancel the appointments was also considered low on their priority list. When using gender as a variable for the no-show rate, it was founded that females had the higher rate of no-shows with 58%, and most of the articles that I researched that were based on genders in dentistry dealt with anxiety and dental phobias. Dentally anxious patients tend to present with more long-term avoidance behavior and seem to only seek emergency dental treatment when in extreme pain. And an article that I also researched is stated that dental fear and the avoidance of these dental treatments is more prevalent and severe among females than it would be among males. When using payment status as a variable in the no-show rate, it was found that Medicaid-insured patients were the highest rate of no-shows in the payment status category with 56%. The other status categories would have been sliding fee patients as well as private insurance patients. Not enough dental facilities accept these public health insurances such as Medicaid, CareSource, United Healthcare. And I've actually dealt with this personally. When we refer our patients outside of our dental clinic, they have a hard time finding a carrier or a dentist office that will accept their insurance. Social Security Act was established in 1965 to make dental available to those who qualified as low income. And 1 in 3 Medicaid patients actually will miss their dental appointment. And like I said, working in a public health facility, we come across this a lot. And I also concur with this article by Brish that stated this. In conclusion to my research project, I find that the most important or essential part of my job is to take an extensive dental and medical history. This helps me create a better and more individualized preventative dental care treatment plan. It's more directed and better quality dental education, like I said, that's more individualized to my patients. I always schedule hygiene recall appointments. This keeps the patients on a plan and goals. I educate the patients on preventative dental treatments as well as the importance of keeping these treatments. I remind them that their dental health reflects their overall body health. I put more emphasis on keeping the future appointments, and I make rescheduling dental appointments more difficult and less readily accessible, and this seems to have a better effect on them actually keeping their appointments. The number one concern in most dental offices is broken appointments, and while it may be nearly impossible to entirely eliminate the no-show rate, it is possible to continue to decrease the rate of broken appointments by educating our patients.